Welcome to LeagueMed's 5x5 podcast. Today, we're talking to Eugene Malinskiy, the co-founder and chief product and technology officer for Lazarite. My name is Kate Morgan. I'm a member of the LeagueMed team, and I'm thrilled to be hosting today's conversation with Eugene. For those of you who are not familiar with LeagueMed, LeagueMed is a free-to-join membership community of healthcare professionals, investors, and anyone interested in public health and medical technology. Our hub provides information on cutting-edge medical innovation, like we'll learn about today from Eugene, continuing medical education, and an investment platform for accredited investors with private offering opportunities in medtech and health IT. If you are interested in exploring free membership, visit our website at leaguemed.com. Our 5x5 podcast is named after a term used in radio transmission, which means the message is loud and clear. Our goal here is to give voice to founders and investors to explain the latest innovations to our members, bringing clarity on why they matter to both doctors and patients and the healthcare system. We'll do this with 5 question areas. Eugene, I love your company's mission, a company devoted to solving impossible problems, making them possible to improve people's lives. And of course, your product, ArthroFree, which is the first wireless camera for the operating room. So lots of good things to talk about here. I want to first delve into your personal path to entrepreneurship. We always find it interesting to understand the motivations that drive people to innovate and explore and take the huge risks that you've taken. I'd love to hear a little bit about your path to entrepreneurship. You've lived all over the world. You're Ukrainian, but you ended up in Cleveland as a child and stayed there. Tell us a little bit about your international experience and your path to entrepreneurship.
Yes. Kate, thank you, number one, for hosting me. I'm very proud to represent Lazarite and very excited to tell my story and our story. So, right to your question about path to entrepreneurship, right? I was born in Kiev in Ukraine. Then there was actually Soviet Ukraine. Mom and dad brought my brother and I. My brother is one of the other co-founders. Mom and dad brought Ilya and me to the U.S. after the fall of the Soviet Union, shortly thereafter, and we came to the U.S. Actually as Jewish refugees, and so pretty much the standard, like, shirts on our backs. I think we had 2 suitcases for the 4 of us, and it was us. It was grandparents, and so we came to the U.S. We actually landed in New York, and then sort of through some fortuitous circumstances, we had some very distant family in Cleveland, which is where I'm sitting right now, which is where Lazarite is based. We came to Cleveland after we landed in New York. And so that's the very beginning of my sort of journey. I went to
Eugene,
school.
how old were you? How old were you when you landed in Cleveland?
10, 9, 10. I went, when I started in the U.S., I started in the 4th grade.
Okay. So you have memories. You have memories.
Yes. Oh, I have memories. Yeah. So I actually, right. So I actually fondly remember my childhood and right. Ukraine, for whatever they may say, right? For kids, Ukraine was a fantastic opportunity and a fantastic place to be and a fantastic place to grow up. So I do have fond memories of being there and friends and school and all the activities that we could do.
It's a totally different conversation to think about what Ukraine is.
What is happening today? Very right, and I do for any listeners. Yes, I have family there. The very short version is I have family there. We helped get some family out. We still have a lot of extended family there. Especially a lot of elderly family, and they're just not willing to leave. And it's always interesting what people get used to because we'll call them, and in the background you hear the sirens, and you're like, "Hey, aren't you going to go to the hallway or something, or to the shelter?" They're like, "Ah, been there, done that. If the apartment gets hit, then that is what it is. But it's more important that I participate in life and that I continue doing what I'm doing and what I love doing." So anyway.
Okay. Well, speaking about family, I know your father had something to do with inspiring your
Yes.
entrepreneurship.
Yeah. So
It's
so
a dual passion, both medical and entrepreneurship. So I'd love to
and right.
hear about.
So my dad. So this is was always very interesting for me growing up. So dad attempted actually starting in, and I guess was actually somewhat successful at starting a company even before the fall of the Soviet Union, right? And largely private companies were banned, right, in the Soviet Union. And so the fact that he had like an enterprise, and he was right. Parents had me young, so he was under 30. So he started this company. So he got bit by the entrepreneurship bug himself. When we came to the US, uh, it did not take him very long. I think within the first 2 years of us being in the US, he ended up starting a company himself. And all throughout sort of my childhood and then into adulthood, right, he's actually always had um, some sort of a company. And he ended up settling, right, most of the time, he actually ended up settling on a travel company that then morphed into also a logistics company. He was able to work with shipping and importers from around the world, and so that was always wonderful to see. Right, that was my childhood. Was dad and parents who were all about entrepreneurship. Were all about making your own way. Right, sort of the standard immigrant story in the U.S. Right, I followed, right, you can say that I am sort of the poster child of that story, right? Come to the US with nothing and then be able to make something happen. But right, I am actually starting with the amazing example of my dad and my parents who were the first to do that.
So it's an amazing family story of entrepreneurship and immigration to finding a place where they
Yes.
could pursue that entrepreneurship. It's a great story.
Yes.
So it was kind of fait accompli that you were going to be an entrepreneur. It sounds like, and I think Lazarite, I think is your fifth startup, if I'm
It
right.
is my fifth startup, right? So I actually had my first company at 16, and I actually started in the IT space, and I had an exit in my early 20s, again, also in the IT space. And that was very interesting. That ended up being um, a very interesting time in sort of the IT world, where a lot of the what are now sort of the standard technologies, the Amazons and the Googles, were the Dropboxes of the world were just starting, or were getting going. And if so, it was a wonderful time to be in that sector, and I was on the more hardware side of it, and I was able to make an impact and grow a company and then exit it. So I'm very, very happy with that.
Well,
And so that
it's
was
it's a little bit unusual to have your first entrepreneurship venture actually exit in so short a time and actually exit and not fail. So it obviously, one, was a good idea, but two, you were actually really fortunate that it kind of reinforced the idea that entrepreneurship pays off.
absolutely 100%.
Yeah, yeah. So tell us a little about the inspiration for this. Now we're in our second category, the inspiration for today's the innovation we're talking about today, which is the arthro-free.
Yeah,
Or,
right.
yeah.
So the second, so Lazarite, right? What uh, became Lazarite started off as after an incident that I saw at my prior company. My prior company, Dragon ID, was a medical device consulting firm. So we worked a lot with surgeons, hospitals, companies, all the way sort of from sketches on a napkin all the way to products in the marketplace and all throughout that sort of continuum. Um, as part of the work that I was doing and that we were doing, I ended up in an operating room, and um, they were ready to start a case. So there was a patient on the bed. Patient was intubated. Patient was draped. For anybody in the sector, what that means is that they're seconds away from starting surgery. And what had happened is that the PA walked by the bed and tripped and fell on the cables from the camera, because this was a minimally invasive case, from the camera. And later I heard that she was out for a long time. The surgery was scrubbed, the sterility was broken, and it was a disaster. Um, but I'm the visitor in this room, right? I'm the visitor in the room, and I'm just sort of standing back, and I'm saying, "Oh my God, this is crazy. This is like one of those never events that you're never supposed to have." And here I'm witnessing it, and sort of then the realization comes of, oh my God, like, why are there all of these cables in the rooms? How many of these cables exist in procedures? And then you start sort of thinking about it, and you're like, oh my God, this was a minimally invasive case, happened to be an orthopedic case, but the same sort of cameras are used in every minimally invasive case, right? So um for any of the listeners, right, you've probably heard minimally invasive surgery, right? If you want to think arthroscopic or lap or GYN, fundamentally, in order to do any MIS case, what do you sort of need, right? You make a couple of these small incisions. What do you need? You need a light into the body, right? That's how the body is dark. And then you need an image out or video out of that body, and you're putting that on the monitor, right? Today, you put that on the monitor. It used to be that we would sort of look at it through an eyepiece with our eyes. Um, but today, you put that on the monitor, and then you have some other tool that maybe is actually you're using to do the procedure, whatever that may be. And so, every minimally invasive case, I don't care what um, sort of anatomic system it's on, or the patient uses some sort of a camera system. There are millions and millions of these cases every single year in the US, and obviously even more globally. And except for where they have our system, um, every single one of those systems uses a camera that has at least two cables, right? It has a fiber optic cable to provide the light. That's where the light goes. Then it has a power cable to provide the video. Um, and so, going back to the original story, I sat in that room and I was like, "This is crazy. Can I make a wireless surgical camera?" And it turned out that the answer was yes. It was very difficult. We had to invent new technologies to do it. We have a ton, over 35 filed patents around the world.
Oh my gosh.
Um,
Wow.
we had to do a tremendous amount of work. We then had to go and work with the FDA, and we are actually very fortunate. We were able to receive FDA clearance. This is a Class 2 medical device. We're able to receive clearance for our system for any minimal invasive surgery, which is wonderful. So we're not confined to just say orthopedics or ENT or GYN. We can actually use our system across any of these cases. And then we launched, and we did sort of a soft launch, gathering feedback, making sure that the product was meeting expectations. And then late last year, we released the second version of our device, that was sort of the improved version. And we've been very fortunate to have done significant number of evals, and we're looking at revenue this year.
That's great. So there's something about the entrepreneurial brain that's in an operating room, and sees a significant problem, like somebody trips over the wires and creates a canceled surgery and potential harm to the patient, and thinks not only, "Hmm, that's a problem I can solve," but secondarily, and it has a big TAM, right? It has a big target addressable market. It has a big market size,
It
right?
has a big TAM. Yes.
So your entrepreneurial brain is problem, how what's the solution, which sounds like it was more complicated than you maybe thought it would be with all the different patents and everything you needed, but that's also part of entrepreneurial
That's how that works.
is you kind of ignore that part. So, big problem and big market for that problem, I can figure it out.
Correct.
Yeah,
Correct. Correct.
that's
And then just because in case anybody is going to watch this on video, um,
oh, yes, 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 did you get the camera? Or did you get the one with all yes, okay.
this is all of the cables. So this is the camera. This is just one of the standard industry cameras, and these are all the cables. So this bright cable is a fiber optic cable. By the way, this causes operating room fires. Patients get burned, and drapes get burned, and staff get burned all the time on these cables, on this fiber optic cable. It's actually a huge problem by itself, right? And imagine that all of these cables are actually draped across the patient because the screen is usually on the other side of the bed, and so from where the surgeon is working. So all of these go across the surgical site, and then the surgeon is holding and maneuvering all of these during their operation, right? And that our system eliminates all of that. And this is our entire system. This is the camera, this is our light, goes into a standard scope, and that's all you need.
Okay, so here's where a picture tells 1,000 words is worth 1,000 words. That is amazing. That's amazing. So tell me a little bit about the better we're working this is the third kind of area, which is better health outcomes. Obviously, there's the danger of an accident by tripping over the cords, but tell us about the better health outcomes that can be expected. The surgeon, I'm guessing, can move more freely and more flexibly, so maybe can better operate or get into places they couldn't get into before. We've talked about the risk of fire. The staff you mentioned before really loves it because in terms of setup. But tell us a little bit about the better outcomes for the patient and for the staff and surgeon that will happen because of this innovation.
I was gonna say, can I hire you? You just did a wonderful job. For you did that was the amazing value prop description. Yes, so actually, just like you said, so right, so up and down throughout that care continuum, right? uh, for the staff, right, when you're setting up that surgery, you have all of these moving parts and pieces, and you're doing it on a short timeline, right? You want to get in and out of the room, especially in ASCs, and we'll come back to that. Um, it is very important to keep things moving. And when you have these fiber optic cables, you're opening these big trays, you're throwing this over a patient, it really gets in your sort of flow and it interrupts what you're doing. And then during the actual case, the staff also have to maneuver around the cables. They have to sort of maybe move them on the operating room site, and it's just a lot of work. And then after the case, right, you have all of the sterilization, right? You have to unplug them, you have to go through a sterilization process. Every single millimeter has to be hand cleaned before it goes into the automatic machine. It's a tremendous amount of effort for the OR staff, the SPD, the facility to have sort of a lot of the storage for these cables. So we can literally come in a tray that's a third of the size that they use right now. They take out our system, they put in a battery, they put on the scope, and they're done. They can just put it to the side and focus on the other activities. So that's for the staff. They love it. It makes them faster, right? And potentially can make the surgery faster, but really can make the room turnover faster, which is so important
From an
in
economics
facilities
perspective.
that are
Yep.
very cognizant about how many patients can we get through the day.
Yep. Yep.
For the surgeon, right, it's all about the freedom of movement, it's comfort, it's lessening, uh, right. And a good example is, right, if you have different ports, right, these different incisions that you've made in say a joint or inside, like you're doing a lab case, right, inside the stomach, right, you need to move your camera around from position to position to see better inside the body. When you're moving them with the cables, it just takes sucks. You have to take out the cables, you have to move it. When the cables get tied up in your tools, and you have a lot of tools on that OR, it's sometimes like sitting right on top of the patient. It's a big deal for the surgeons to have that freedom of motion, but also to maintain their image quality, to maintain the things that they can see, what they expect to see. It's crucial for the surgeon, and we provide that along with the wireless image. And then, right, right, for the patient, right, there's the risk of fires and burns that we literally eliminate. Our system will never get hot enough to cause that drape fire, which is amazing. Um, and then, right, you have the sterilization, so you have an infection risk elimination with our system. But then you also have a category of surgeries, and I'll use ENT as an example, which are more and more procedures are now wide awake or even happening outside of the OR, maybe happening like in a procedure room. ENT is a really good example. Let's say you go to an ENT. Every one of those ENTs wants to stick a camera up your nose and take a look around. When you have all those cables, right, you're already not very comfortable. They're like draped over you, the patient, and it is not a very comfortable experience, and you may not feel very safe. And so, getting rid of those cables, and the surgeon saying, just hold still for 30 seconds, I can put this in, and they can come in, they can come out without all of this extra gear. It legitimately makes the patients feel safer. Um, and then you can just do some other procedures faster too.
Yeah. I can imagine that. And of course, you wouldn't get burned, right?
And you don't get burned.
So, as an innovator, and also when you get market feedback and understand the technology and develop more patents, there's always an improvement. What are the future innovations for version 3 of the ArthroFree that are, I think, coming this year, if I'm right?
So we're always getting feedback. So right, so when we did a soft launch with ArthroFree One, we went out to our surgeons, we went out to the community, did a pretty significant number of cases, and got a lot of feedback. Most of that feedback that we received was um, image quality. They wanted slightly different colors than what we were providing. They wanted, some would say, sharper images in some cases, but not in others. And there's a couple, let's call it quality of life things that the surgeons really asked us for. And so we released Arthur Free 2 with those changes and quality of life improvements. There's more that we have heard feedback from the field. We've done thousands of cases. We're at 3, 4, 5,000 cases. We're at, I think, well over 4,000 cases at this point. And these are the ones we know about, right? Because we have facilities that just use our system and they just use it. We never hear about it. They love it, and they will tell us like, "Oh yeah, we probably did 900 cases this year." Great, okay. So so we always are getting feedback from the field to make the system better. So we will have further updates to our current system, and then we will have a major, let's call it technological jump for the next system, which is going to have all new wireless, all new image sensor, all new sort of internal components. It will look different than the current system. And so we, right, we're at the point where we are very comfortable with what we have learned from the marketplace in order to make the next sort of technological and practical jump. And the team is very excited about putting that future product on the market in the next few years.
That's super exciting and also a really great example of continual improvement and market feedback and understanding what people are how are actually using it on a day-to-day basis and how it could be better.
Yes,
I
yes.
love that.
And and Kate, if you don't mind, I do want to mention that, right? We've also heard the feedback from the field that, look, you made one portion of my um, workflow wireless. There's other tools that some of them have a wire. Can you make them wireless as well? And without sort of revealing anything, we're very interested in that.
Okay, we're getting secret information. That's great. And you have some very significant partners, if I understand. HSS is using your tools and
E-
also NYU.
NYU and university hospitals as well,
That's great. That's awesome.
which is wonderful. Yes, we are very so for any investors listening. We as a company have always prided ourselves on our very diverse investors. So we have individuals, a significant number of sort of individual surgeons who just want to use the product, right? They want to get it in their hands. But then we also have family offices, we have VCs, we have foundations, and we also have um, these highly innovative strategic hospital systems that are investors as well as clinical partners. Like we have done and published peer-reviewed research with one of them. We have used our um, relationship and sort of the strategic thinking on making improvements to our system with another one. And so we are when we work with investors, we deeply value what they can bring to the table other than just their money. Obviously, we value the money, but we also very deeply value what it is. What else is it? Is it connections? Is it innovation? Is it the ability to get us into clinical practice? What is it that we can partner with our investors in order to move the company forward and ultimately, right, to make it work for the investors in the future in some sort of an exit or M&A scenario.
Right. That's a really important way to think about investors as partners with information and clinical use that can give you more information about what comes next. We touched about you touched on this earlier, but I want to kind of revisit it again, which is what do you think in your current investors or future investors should know about your FDA approval and what that means for the market size of what ArthroFree could become?
Yeah, thank you. So I mentioned that, right, our global TAM is tens of millions of procedures a year. It's truly mind-boggling. These surgical towers, these visualization systems are in virtually every single OR in the US and many, many ORs across the world. Just because, right, in the last 20 years, right, this is a little bit of a sort of a 10,000-foot view, but right, procedures that used to be open procedures, right, where surgeons would cut the patient in order to do the procedure, became minimal invasive procedures.
Right. So that market
Then
is
those
growing.
minimal
That
invasive
market's
procedures,
growing, right?
yeah, right, those minimal invasive procedures then moved from the hospital to the ASC. A great example of this is
Wait,
orthopedics.
can I just make sure you ambulatory surgery centers is
Thank
ASC?
you. Yes. Thank you, Kate. Ambulatory surgery centers, ASCs. These procedures moved from these big hospitals into ASCs. Orthopedics is a great example of this, where and the data bears this out that the surgeons who do a lot of the procedures and who have high volume in these facilities that don't keep the patient overnight, so they minimize infection risk. They are very, very good at what they do. They use the best sort of equipment they can get their hands on, both save money for the patient, but also have fantastic patient outcomes, right? You get better patient outcomes, broadly speaking, in an ASC setting than you do in a hospital setting, right? So you went from big open procedures to procedures becoming minimally invasive, and more procedures are becoming minimally invasive to
Because of
procedures
the
moving from the
technology that you can
as
see.
technology gets better, right? Right. ArthroFree is a product that sort of exists in that continuum, right, where you can take what used to maybe be a hospital procedure and move it into the AC, or as I mentioned earlier on the ENT case, right, you can move a procedure that used to be in an ASC and move it into the office, for example,
Right.
right? So there's we a wonderful example of this is carpal tunnel surgery. So we have a surgeon that we work with, and this is something we're very interested in. Is he does wide awake minimally invasive carpal tunnel surgery. It is literally you walk into his office. They get set up. They do not put you to sleep. They just do like local anesthesia. They use our system, and they are done in 5 minutes. You
So
walk
cheaper,
out, and
better, faster.
you walk out, and you're able to get back to work the next day.
That's amazing.
It's
That's
amazing.
amazing.
Right. So we go from hospitals, we go from open procedures, hospitals, to minimum invasive procedures, to ASCs, to even sort of these outpatient, and even to doctor's offices. And throughout this entire sort of continuum, right, everything keeps going this way as the surgeons and technology get better. But that also opens up the TAM for MIS just keeps growing,
Yep.
right? As you sort of expand what you're doing and where you can do it and how you can do it, every single one of those procedures needs a camera because you need to look inside the body in order to do the procedure.
Right. Right. So ArthroFree is really positioned well for what is happening organically in the minimally invasive surgery space. And it's going to be part of that growth. That's amazing.
Correct.
Well, that's a super exciting innovation. I've loved this conversation, Eugene. And thank you very much for joining me. And I look forward to seeing this publicly so we can be loud and clear, 555, about your innovation. Thank you very much
Wonderful. Thank you very much.
and good luck.